Hello, my name is Pauline Hunt, and welcome to Team 6's project, Family Health Assessment, Family Health in Mid and Later Life, Congestive Heart Failure. This is Nursing 480, Family Nursing Theory and Practice, Spring 2017, and this project is presented by Monica Athwell, Lance Espiritu, Vanessa Fortin, Pauline Hunt, Kathleen Lopez, Keith Sousa, and Ronalyn Tiongson. Introduction. The Sanchez family is comprised of a father, mother, son, daughter, and granddaughter. They are an American family of Mexican descent. The three-generation family of five resides together in a three-bedroom apartment in Los Angeles. The primary language spoken is English, but all members of the household also speak Spanish. 3 members of the household are employed. This traditional extended family is Catholic, but only attends services on major religious holidays. They eat dinner together in front of the TV as often as possible, depending on work schedules. The incident. Felipe Sanchez was recently taken to the hospital by his daughter for increasing shortness of breath and generalized malaise. An echocardiogram was performed and revealed an ejection fraction of 22%. The cardiologist added lisinopril to Mr. Sanchez's lengthy list of medications for congestive heart failure. Prior to this hospital admission, Mr. Sanchez was able to ambulate independently on room air. He requires BiPAP when sleeping. Currently, he uses a 2-wheel walker and gait belt to ambulate with nursing assistants in the hospital. However, his family chooses to let him use the wheelchair to move around the ward, despite being told to encourage ambulation. Mr. and Mrs. Sanchez. Mr. Sanchez is our non-compliant patient with multiple comorbidities, including congestive heart failure, for which he has recently been admitted to the hospital. Mrs. Sanchez is his wife, who worries about her husband's condition, but seems unable to change his compliance with his overall health care. The Sanchez children. Gustavo Sanchez is Mr. Sanchez's son and has become the head of the household. He also helps his father make healthcare decisions. Alicia Sanchez is Mr. Sanchez's daughter. She is now his primary caregiver after having to give up her well-paying full-time position at work for a part-time position. The Sanchez granddaughter. Christina Sanchez is a happy 10-year-old who would love to have her grandfather come to her soccer games and to her open house at school. Family structure. Developmental stage using Erickson. Erickson's developmental stages help describe the family structure. Failure to successfully complete a stage can result in a reduced ability to complete further stages, and therefore a more unhealthy personality and sense of self. Family structure, internal, external, and contextual. The Sanchez family relies on itself for support during illness. There is very limited extended family and they do not live nearby. Most members of the family share their frustrations and fears with their coworkers, friends, or teachers. However, Alicia is not sharing her fears and concerns with anyone, which may lead to more physical or emotional problems for her. Thank you.
Hi, my name is Kathleen. I'm going to be doing the family assessment. So first we have a genogram that shows all the different levels of the family tree, along with the illnesses that they suffer from. We have Rodrigo and Maria, who are Felipe's mother and father, who died relatively young from a heart attack and from breast cancer. Then you have Felipe himself and his wife, Lucila, 56 and 54. They suffer from different ailments, including CHF, hypertension, sleep apnea, morbid obesity, osteoarthritis, Lucia, obesity, hypertension, diabetes type 2. His daughter Alicia and his son Gustavo Alicia is obese she suffers from uterine fibroids. Gustavo has a smoker, hypertension, and obese. Christina has asthma and overweight, and she is Felipe's granddaughter. So Felipe currently lives with his wife, daughter, son, and granddaughter. His daughter, Alicia, is his main caretaker. She helps him take medication. She will assist him with his daily activities of living. However, Felipe consults with his son to make healthcare decisions and really relies on what he says to kind of guide him, and he trusts his son very much. Both Felipe's parents are deceased, as I stated before. So we see that there's trends within the Sanchez family that shows obesity is running through all levels of the genogram. And Gustavo suffers from hypertension just like Felipe and is at risk for developing CHF later in life, along with his wife Lucia. So now I have an eco map. The eco map shows the relationship between Felipe and his different communities around him. So the squiggly line shows that it's a challenging relationship, and then the double solid straight lines are a strong positive relationship. So Felipe's relationship with his family is very strong. They are very supportive and help him every day. So as I stated before, he relies on his daughter to help him with medication and with pretty much just, doing regular day-to-day stuff. In his religious community, he's has a very strong relationship with with a lot of people in his religious community, and the community itself provides a lot of social support, especially since Felipe has been sick. So since he's been sick, the priests and members of the community will come and visit him and provide him with communion, and just kind of makes Felipe still feel like he's able to be a part of the community. But prior to his sickness, he would attend church pretty regularly, and his family still does attend church pretty regularly. So his health and his independence, as illustrated by these squiggly lines, are very challenging for him. So he struggles to maintain his health, and as a result, he's slowly losing his independence. And Felipe is slowly requiring more and more assistance with caring for his basic ADLs. And during this specific hospital admission, he's requiring a significant amount of assistance with caring for just himself and helping him just go to the bathroom, helping him put on his clothes. He gets very short of breath. So the Felipe usually is caretaker for his granddaughter while she comes home from school, and he watches her. However, since Felipe has been hospitalized, no one's able to be at home for Christina when she's coming home from school because everybody has a full-time job, including Felipe's wife. So as a result of this, Alicia has had to step down from her full-time work position to care for Felipe after his hospitalization, but also to care for Christina while Felipe is in the hospital. And this has caused a significant loss of income. It's almost a third of the income, so that's one of the biggest stressors. And that's why the household is designated with the squiggly line as well, because they're kind of struggling just to get by. So we might need to kind of help them out, find different programs that might be able to, assist Christina, or maybe Elisa can find some time to maybe find a part-time job to kind of decrease the stress of losing an entire income like that. That's it. Thank you.
Hi, my name is Monica Apple, and I'm going to be going over how the chronic illness framework model fits the Sanchez family. And so why is chronic illness so hard on families? Is because it creates a disruption in family routines due to multiple scheduled doctor appointments, unexpected hospital visits, And this all affects keeping a consistent family schedule and routine for both personal growth and autonomy for every member of the family. This also can prove to be financially draining as it impacts lifestyle requiring changes in habits. And finally, it is emotionally draining as resources are pooled into stabilizing the situation where little is left over for normalcy or the life once lived before the illness started. However, there is a positive to chronic illness when successfully managed, and that is the bringing of the families together by the struggle they overcome to help get that family over their managing their disease. And so the chronic illness framework developed by Roland in 1987 fosters understanding of how chronic illness affects the family. And there are multiple factors of illness which influence family functioning, such as, and the three major elements include the illness types, onset, course of disease, outcomes of illness, and degree of incapacitation of the family member. And so there is always an overarching degree of uncertainty about the illness itself, which affects families. And an expert by Kikian I really enjoyed reading was when individual family members have a progressive chronic illness, the disability occurs in a stepwise fashion. It requires families to make gradual changes in their roles to adapt to the losses and needs of the family member as the illness progresses in severity. The families must address perpetual symptoms which require continual adaptation mixed with minimum periods of relief. And this was found on page 88. During the initial diagnosis, it is important for family members to work towards achieving three goals, and that is to establish a positive working relationship with the healthcare providers, gather information about the diagnosis, and accepting of the diagnosis. This is often the period where exhaustion sets in, where new family roles develop with caregiving tasks. Alternating periods of stability and disease exacerbation bring uncertainty to the family, which can become emotionally taxing for everyone involved. In Felipe's case, his heart failure condition is especially unpredictable, with the reported ejection fraction of just 22%. The time phase of illness, which where you have the initial diagnosis, day-to-day adjustment phase, and the terminal phase, during this mid-time phase of, or otherwise known as long haul, it's important for the families to learn how to pace to avoid burnout, sustain autonomy for all family members, accepting of the treatment plan, and adjusting to the situation. Also, it's important for them to redefine what is normal and learn how to balance the needs of each family member. During the terminal phase, this usually happens when a family member is dying. And this kicks off the grieving process, so where comfort care and learning to let go becomes the new goal. Nurses are available to help family members with like a cascade of decisions while the family works on developing a new identity after the family has passed away. And so finally, family functioning is also very important, where demands of managing the illness and family strengths and vulnerabilities are closer looked at. Where, in the case of the Sanchez family here, I kind of listed a quick point of view look at where the son, Gustavo, he's assumed head of household, where he struggles with his smoking addiction, obesity, hypertension. His stress levels are poorly managed. He attempts to take his father for follow-up visits, but usually that doesn't happen. Also, the daughter, which is the primary caretaker, she's stuck in the sandwich generation where she's taking care of her father at the same time taking care of her daughter, where she suffers from chronic pain from her fibroids, as well as putting her career life on hold. She was able to get advance and get higher pay, but she chose to go part-time instead. His wife, she still works. She also suffers from comorbidities of diabetes, hypertension, and obese, but she has poor eating habits. She normally goes out and takes fast food back home. And also the granddaughter isn't really getting much quality time with her grandfather. However, the strengths exhibited by the Sanchez family include a sense of togetherness. You don't normally see that kind of a family unit most of them are spread out, and they go on and do their own thing. Also, there's initial acceptance of the disease, where this is bringing stress to the entire family. They're trying to get Felipe to get on board with his disease process and taking care of it, but he's kind of making it hard on them. However, where the family falls short is in their execution and adaptation of teachings into the home environment, where Felipe is non-compliant in his medications as well as following through with his regular routine checkups at the hospital. The family falls short by allowing Felipe to sit around all day watching TV instead of encouraging him to increase his exercise. The fact that his wife is bringing home fast food indicates a lack of self-care as well as for her family. His daughter appears to be the only family member truly concerned for the family's overall well-being and has experienced tremendous burnout. While her brother, Felipe's son, appears to be keeping himself away from the family so he can enjoy his cigarettes. The granddaughter suffers from asthma, and so he cannot enjoy a cigarette. But at the same time, he's also longing to start his own family, and so it seems like he's spending more and more time out of the home environment. And so, coupled with this, under the how Felipe's condition is affecting the entire family, is causing extreme burnout. And so there needs to be a balance that needs to be found in this whole situation. And the way that it can take place is by readjusting the roles, where they alternate caretaker responsibility so that it does not fall all on the daughter, Alicia, in this case.
Hi, my name is Vanessa Fortine, and I will be discussing two of our family nursing interventions and outcomes. A qualitative study by Voltelen, Conrasden, and Ostergaard that I found reviewed the efficacy of family nursing therapeutic conversations in heart failure patients. These conversations led to improvements in the families and positive perceptions towards its validity as a tool amongst the nurses. From this study, I have pulled two interventions suggested by Voltelen et al. And the outcomes noted as a result of these interventions. The first intervention is an open illness narrative, including the entire family while creating the genogram or doing some sort of assessment process. In the study, the nurses had between 2 and 3 encounters with the same family suffering with heart failure. The first encounter was established by creating a genogram, and this is an assessment tool that can allow time for intervention. According to Voltelen et al., this allowed an open illness narrative, which led to strengthening family bonds. So that's the outcome we're looking for, is to enable family bonding. Each member, when they are present in this open illness narrative, will learn how the illness affects the other. In this narrative, in our particular case, we may learn how the illness is affecting Alicia, or if the children are okay with driving their father to appointments because he no longer can drive. And then maybe Felipe may learn how much Lucilla, his wife, is fearful of his deteriorating condition. In the study, they found it was important to include all family members' perceptions so that they learn each other's experiences with the illness. Family nursing intervention number 2 is to ask interventive questions that clarify, allow for reflection, while the nurse abstains from giving advice. Interventive questions are defined as reflective questioning. An example of this might be what's happened since the last time we saw each other. In our scenario here, maybe we could ask questions like, what fears do you have about your father or your husband's condition? What sacrifices are you making that maybe you don't want to make? And the outcome that we're looking for here is psychosocial equalization, according to Voltelen et al. And this type of questioning naturally allows for problems to arise, while the nurse's curiosity leads the family to create their own solutions. The platform brings compromise among family members and helps them to coexist with each other while living alongside the illness of heart failure. So these family members might hear one of the others maybe say taking dad to the appointments on Monday morning is really stressful for me. I can't get to school on time afterwards. And then maybe Alicia will hear her brother say that and say, I can do Mondays if you can do Fridays. So the family gets to actually hear what is causing that stress and tension, and this helps to decrease it when they create their own solutions. Thank you.
Hello everyone, my name is Lance Espiritu and I will be doing family nursing intervention and outcome number 3. That is to provide patient teaching that is easy to understand and to emphasize the importance of taking medications. To do this, we can use easy to read and large print information on CHF to explain treatment. The outcome is to enhance the patient education and to increase understanding, which will reinforce compliance. Medication compliance reduces the risk of readmission to the hospital. A study done on elderly patients that were recently discharged with a diagnosis of congestive heart failure showed that the compliance with medications is a strong indicator for the risk of readmission into the hospital. Using mediums such as pamphlets, brochures, and videos for the patients and family members in order to understand CHF management increases medication compliance. The image to the right is an example of the American Heart Association's pamphlet for congestive heart failure. Thank you.
Hi, I'm Rana Tiongson, and I'll be doing my part on stressors. Stressors are any chemical or biological agent, environmental condition, external stimulus, or an event that causes stress to a person. Based on our theory, which is the chronic illness framework previously discussed by Monica, stressors experienced by the patient and family are determined by 3 factors. One is the illness type, which includes the onset, course, and outcome of the illness. 2 is the time phases of the illness, and this includes initial time, mid-time, or terminal time. And the 3rd is family functioning, which basically is how well the family adapts to the stressors. Felipe's congestive heart failure is a gradual and progressive chronic disease. The worsening heart condition required sudden hospitalization for stabilization and has resulted him in having limited mobility and energy. Therefore, it's made an impact on the entire family and has affected family roles, caused physical stress, emotional stress, changes in family dynamics and activities, family functioning, and financial status. Stressors experienced by Felipe include his change of roles, so growing disability to function as a husband, father, and grandfather, because of his limited mobility and decreased energy has resulted to his inability to perform activities of daily living and instrumental activities of daily living. Activities of daily living are basically activities in which people engage on a day-to-day basis. They're personal care activities that are fundamental to caring for oneself and maintaining independence. So because of his illness, he's needing help with bathing, dressing, toileting, transferring to the bed or chair, and walking. Instrumental activities of daily living are activities that are not necessarily fundamental functioning, but related to independent living. And this includes help with shopping, cooking, managing medications, doing housework, driving, and managing finances. Felipe is also experiencing emotional stress. He has fear of the unknown with his illness. He also feels depressed and guilty for his growing loss of independence and feeling like he's a burden to the family. The changes for family dynamics has also been affected. His illness has affected normal family activities such as going to church and spending time with his granddaughter. Stressors experienced by the family members includes their change in roles. Lucila, his wife, Gustavo, his son, Alicia, his daughter, and Christina, his granddaughter, they've all taken on the role as caregivers for Felipe. Alicia has become the main caregiver, and Gustavo has become the head of household and decision maker for the family. Because of Felipe's progressive illness, it's caused physical exhaustion and stress as the family members are trying to adapt to Felipe's limited mobility and increased physical support. The daughter Alicia had to work less hours to help take care of her father, on top of taking care of her daughter Christina. They also have fear of the unknown about Felipe's health, experiencing grieving over Felipe's worsening heart condition, and has fear of losing him. Lucila, his wife, she is feeling guilty for not being able to stay home to take care of her husband due to work and financial responsibilities. The family members are also, they also have feelings of anxiety and frustration about Felipe's non-compliance with medication and going to doctor appointments. They are stressed over trying to balance work, household duties, and taking care of Felipe. Felipe's illness has also caused financial stress due to hospital bills, cost of his medications, and decrease in income, especially when Alicia, the daughter, had to step down from her full-time position to part-time in order to take care of her father.
Hello, my name is Keith Sousa. I will be talking about the implications for family nursing practice related to chronic illness. The Sanchez family and the family's health status as a whole has a major effect on family nursing practice and the healthcare system. These variables affecting this family are common and place a greater emphasis on the role of the registered nurse in the broadening of the nursing process to include the family. Nursing assessments, diagnosis, planning, interventions, and outcomes must be tailored to the needs of the family. Knowledge emerging from the study of family structure, function, and process suggests concepts and a framework that nurses can use to provide effective assessment and intervention with families. With a greater emphasis on the family and the family with living with a chronic illness, these factors are important: prevention, coping with a chronic disease and preventing caregiver burnout, availability of resources, involvement of case management, and evidence-based practice. Prevention, providing community outreach and working with existing entities. Some of these include March of Dimes, American Heart Association, the American Diabetes Association, etc. Also, coping with a chronic disease and preventing caregiver burnout is definitely essential, especially with the Sanchez family. We're kind of already seeing some fatigue going on there, especially while Mr. Sanchez is in the hospital. Quality of life can be negatively impacted by the day-to-day responsibilities of caregiving, as well as by a care recipient whose health is declining and moving towards the end of life. To minimize these negative effects on the quality of life of the family unit, nurses and other healthcare professionals need to conduct periodic assessments of the family caregiver's needs and capacity to assume and or continue in the caregiving role, and implement interventions to help prepare the family on its journey through the chronic illness trajectory, dependent on strong nursing assessment of the family unit. Also important is the availability of resources, proper discharge instructions, handing out the required pamphlets such as the disease description, smoking cessation, medication teaching information. Hospital-related programs such as diabetes education, incentives to encourage patient involvement. There is a big push towards this. Kaiser, for example, offers patients the chance to earn gift cards if they complete online workshops and classes. Also, transportation services, offering these kinds of things for our patients, like taxi fares, bus passes once they're discharged, and even bringing them back to the clinic. Also is the involvement of case management and or social services. This can help as an educational tool and provide follow-up care when patient is ultimately discharged. The priority being positive patient outcomes and patient safety should be emphasized as a resource and not a form of punishment or scrutiny. And lastly, evidence-based practice. Policies, reimbursement for the hospital, coverage for the patient. These policies are continually changing. We do know that economic costs for chronic illnesses such as diabetes are continuing to increase. Reimbursement for care being provided by the hospital, holding the hospital accountable for patient outcomes. Incentives for these hospitals to keep patients from re-entering the hospital. Facilities have to follow strict guidelines, for example, in order to receive Medicare and Medicaid reimbursement. Coverage for the patient. The Affordable Care Act is still in effect. Everyone is required to have medical insurance by law. I did list at the bottom of the slide some internet resources. The one that I really liked of note was the Medicare Home Health Compare, where patients can easily compare prices, and these health insurance companies can actually compete to bring this patient better coverage at a lower price. Next, there's also a big emphasis on society and community involvement, an understanding of chronic illness, resisting judgment out in the community for those with chronic illness. Kakinen outlines social determinants that can result in health disparities. It's important that the public's educated on these. There's a greater need to identify these factors such as poverty, gender, race, ethnicity, presence of chronic illness, health literacy, definition of family, education, health resources. Continued research related to family nursing. It's important that there's a pursuit of higher levels of nursing education and even the use of nursing organizations. Registered nurses with associate's degrees are looking to obtain their bachelor's degree. Hospitals are given incentives to hire more RNs with their bachelor's degree. For example, the American Nurses Credentialing Center awarding hospitals magnet status. Facilities are able to draw in more patients and clients through this form of recognition. The potential to offer better customer service related to higher levels of education. Nursing organizations also allow for national and even global networking. Examples include American Nurses Association and the American Association of Colleges for Nursing. Communication using technologies such as email, video streaming, posting interdisciplinary articles relating to patient care. Again, this is all being affected by family nursing practice and the emphasis that we're not just treating the patient, but the entire family. This last and final slide is our 2 reference pages. Again, thank you very much.